hear different things at different times. But the governor, as I said, called special session to start on November 3rd. From from a legal standpoint, you have 40 actual calendar days to complete the legislative session once it's called and called November 3rd, or 30 session days, whichever is met first. And that was all to deal with the redistricting of the congressional maps. We do 3 maps: House map, State House map, State Senate map, and congressional map every 10 years. And based on some noise and pushing from and encouragement from the President of the United States, he's asking states to consider doing redistricting midway, if you will. And so some states have done that, both Democrat states as well as Republican states. Indiana was positioned to do that in, quote, the special session. And last Friday, late afternoon, Pro Tem Rod Braid had an announcement that said that the Senate Republican caucus did not have the votes to push and pass redistricting of the maps, and so therefore they wouldn't, and they would not be meeting in December. They would come back in January as previously discussed. And so the Senate at this point has said they're not dealing with the maps. Obviously, you have to have both the House and the Senate to pass a bill. The House really has been pretty quiet on it. The governor has encouraged legislators to come back, from the Senate legislators to come back over the weekend. A lot of back and forth with the President of the United States, calling people on their personal phone calls or personal phones, as well as calling them out on his social media platform of Truth. And one legislator was actually, it was taken to a different level when his home was actually swatted over the weekend, and which is really a shame. Everything's okay. He's okay. His family's okay, but quite an ordeal. We've made national news multiple times over the last 72 or so hours, looking at Indiana and what we're going to do. So that's still in the background. And as I said, the noise, will the House finally tell the governor they're not going to do it? The governor's pushing hard to do it. And they don't the House and Senate don't have to do anything. The governor can call, which previous governors have called, special sessions, and basically the legislature says, thanks, but no thanks, we're not going to do it. So, Lou, do you want to add anything on kind of the special session? Okay. So as you can see, Lou's in the hallway. We'll anticipate, or we are anticipating, a lot of activity at the State House, both from the people that want redistricting and the people that don't want redistricting, coming to the State House today to have their views known. But happy to answer any questions about kind of what today is on Organization Day versus the special session. Okay, Sid, it's you.
All right. Well, leading into overall session for 2026, Kelly did mention that they will be convening that first week of January, as typically done. It's a short session this year, so statutorily they have to be done by March 14th. But we have heard from leadership that they would like us to be done by the end of February, which is a very condensed timeline from their already previously condensed timeline. So as Kelly mentioned, bills are already starting to be drafted, they can be filed, meaning that, a lot of these things are going to be vetted and discussed, prior to sessions starting in January. There's not going to be severe fiscal things that are going to be likely passed, since it is a non-budget year, which is good from our standpoint as it relates to our funding. But wanted to share with you all the platform. Some of you might have seen this if you were able to attend the fall conference in Bloomington. Can everybody see that okay? Thanks. So this session, the council has decided not to pursue any proactive legislation. We will still be very much present at the State House. We will still be, monitoring any bills that are filed, attending committee hearings and so on, but meaning that we will not be pushing proactively for any piece of legislation for this session. Given the climate, both state and federally, as it relates to Medicaid and just kind of all the uncertainty, we really want to focus our efforts on continuing to build relationships within the executive branch and the state agencies, and working through those channels to work on CCBHC and Medicaid and all those things. So the first thing for the platform is we're obviously CCBHC is top of mind. Zoe's been sending out a couple updates as it relates to CCBHC, but just continuing to educate legislators on the importance of the transition to this new model, how we can't continue to operate as a two-system network, wanting to be sure to collect as much data as possible, impart on legislators how prepping for readiness, those types of things. So it's a lot of education throughout the platform. So CCBHC, as it was ranked on the policy survey that we took, was the #1 topic. The #2 topic, as I mentioned, is Medicaid. Between state and federal changes, this is going to be really important and something we are going to be monitoring closely through any potential legislation. And this includes, who we may and may not be allowed to provide services to. If we have any undocumented individuals, we've been hearing that there might be legislation surrounding that and our ability to treat those people. So definitely going to be keeping Medicaid top of mind as we look through any bills that are going to be proposed. And then lastly, administrative burden. We have been hearing this from you all for quite some time as it relates to, the audits, a lot of the paperwork, all these things that take away clinical time from being able to see, the individuals that we serve, and just bogging down and those kind of like administrative tasks. So if there are any opportunities this session to try and alleviate any of those restrictions, then we are going to work hard to be sure that we are included in those conversations. And then, of course, our lovely map that we want to be sure to include anybody. So Leanne did a great job preparing this. If anybody would like a copy of this, please let Zoe or myself know. We are happy to send this over for you to share with whoever you think would be appropriate. Any, board members, county council, local sheriff, any of those types of individuals who could benefit from maybe just a quick snapshot of kind of what our priorities are at the council. So happy to answer any questions as it relates to the platform, session, anything like that.
Hello, Sydney. So is this available online, or when would it be available online?
It's a good question, Art. I know we had talked about putting it on the website. I just can't remember.
Yeah, it should be on there. If not, Leanne is in process of getting it on there. It is on our website, Indiana Council.
Okay. Thank you.
You're welcome.
So we explained things so good, or we're all just all equally confused. There's no questions.
Any other questions or discussions regarding this session? I was remiss to also not thank and call out Beth Keeney is on, and she is our public policy co-chair, as well as Matt Burden, who is also public policy co-chair. Both of them are on the Indiana Council's board. Public policy under their leadership has grown very robust and is a very active group that meets once a month. Of course, as we head into session, if we need to evaluate flash or extra communication points, we will definitely share that, as well as email updates from myself or Sid. But Beth and Matt are your two co-chairs leading us in this public policy strategy and discussion. So I really wanted to thank them for their leadership. So Beth, Matt, anything you guys wanted to say in respect to public policy or to the group at all?
No, just thanks. And I guess looking forward to the upcoming session.
Yes.
Yeah, so in the meantime, as we're looking towards January, I would just encourage everybody to take the time, if you haven't already, to share with your legislators what is going on in your respective centers. We've been trying to work on a couple site visits throughout the year, but it's a great opportunity now to show the potential of where you could be if you are not in the demo yet, the great work that you have been doing if you have been selected for the demo. It's just really important that we continue this momentum that we've been experiencing over the past year, really trying to impart on legislators the turning point that we are at, if we can just get over this last hurdle of getting everybody on board. So I just appreciate everybody taking the time. It comes better from you than any of us. So I just, don't underestimate your value in these conversations.
Hey, Sid, this is Steve. Even though it's going to be a short session and, the impact is not as much as, during a budget year, I think, February 17th is going to be here fairly quickly. And so I just want to keep in mind, if there's any strategy, any specific action steps that could be conveyed to the membership would be helpful vis-a-vis what should we be doing now in preparation for legislative day, so that we're organized and again, having the most impact, even though it is just a short session.
Yeah, of course. Thanks, Steve. I will preface by saying some of this might change, come January 5th when, we get the deluge of bills that come down, we might have to pivot and talk about something specific come, February 17th. But overall, I think, continuing to share any, data that you might have surrounding, if you any impacts that you see in your local community. Data has been just such a pivotal talking point, especially if you're living in one of the more conservative areas of our state, about, how many people you've been able to see, talking about crisis services and any of, how many crisis runs have you been able to do, the relationships that you've built within your communities with law enforcement and first responders, any new facilities that you've been able to stand up. I know Steve's going to be having a ribbon cutting here soon. So that's a great message to share. How many employees have you been able to hire? But also share the struggles, right? We've already been hearing about how redeterminations have decreased enrollment for Medicaid enrollees. And so, what does that look like from your perspective? We just want to be sure that we're sharing as much as possible what your guys are seeing on the ground, right? It's easy just to see numbers on the page of, how many individuals are we serving and all those things, but also working to humanize them. These are people living in their communities, and just what we have been doing to keep them within the community as well. I know it's a lot of vague kind of overarching topics, but I just think it's so important just to share the boots on the ground experiences, and even, the successes, but also the frustrations and the barriers as well.
Can I also add something, Sid?
Of course.
I think knowing your data is really important. Knowing your crisis data is very important, but know the other components of your CCBHC model as well. Talk about access, talk about retention and care. This is a really good time, not today, but like next week, the week after the holidays, start calling legislators, let them know that you know, you're invested, give them a heads up. I'm going to be at the State House in February. I'll be reaching out and hope to connect with you, but there's still time, especially if they don't go into special session, to get folks into your centers and really kind of strengthen those relationships. So make contact now, talk about CCBHC Beyond Crisis as an entire continuum of services, not just a crisis continuum, and know your data.
Great question, Steve. And we will be preparing talking points as we get closer. We will also have an invitation for you to give to legislators and get that in all of their mailboxes like we do. The lobbyist team has done that for us. And then you will have an individual invitation via email to be able to send and invite folks to the February 17th day. So all of that you will have in plenty of time. And like Sid said, as far as the talking points and planning, we will have that general outline, but of course, session, we will keep it so that we can pivot and be flexible in case there is anything that we need to defend. So all of those things will be done at the start of like the official, you know, session, so you can start inviting folks. Any other questions? That was a good one, looking at February 17th and kind of building up to that and local stuff. Any other questions or policy, Matt?
Yeah, you know, I'm just wondering, you know, obviously every session, mental health needs more funding and we ask for it. And I mean, this, at least for Porter Stark, this year feels vastly different than any other year because so much is on the line and at the end of funding. You know, if things don't turn around, we're looking at losing millions of dollars if we don't change our staffing. So the only thing that we can do into 2026 is to drastically reduce what we have. And it's a concern for me because we're a service organization like all of you, and we need the funding to employ the people to do the job. And if we have to cut those services or pare them back and then build them up, it's really hard. So I'm just wondering, a lot of this has to do with the secretary, where the secretary stands with respect to evaluating the value of CCBHC. So where are we in that process? Because the other concern I have is if we're telling a different story or making it seem like we're going against where the secretary is at and going to legislators, that he's going to take more of an attitude like he's taken with the hospitals. And it's for anyone that has heard about the call with the Hospital Association, it wasn't pretty. So thoughts on where we're at with Mitch Robe and how we sort of impart to the legislature that this is a different year than most years for what we're dealing with.
Yeah, absolutely. Sid, would you like me to take this one?
Sure, yeah.
Okay, so very good points. Thank you, Matt, for sharing those. So we are doing a lot of work with the secretary, and she hates when I do this, but it is really 100% because of the relationship that Kelly Wagner has with the secretary. And so Blue and Company is working on a crisis and CCBHC sustainability report. That survey we are getting ready to finalize and should go out to all members either today or tomorrow. I'm waiting on our CFOs because it's very fiscal, CFO chairs to give me feedback. But we are going to look at the expenses that we've stood up. We are going to look at the revenue, and then we are going to offer solutions on a sustainable plan. And so everyone knows that sustainable plan, there's not a lot of options within that. However, if you all recall, when we did Senate Bill 1, it had a 988 surcharge attached to it. But due to being in a political transition at that time, that surcharge got stripped kind of last minute. And so we are looking for budget session to bring that surcharge back as a sustainable option. We're going to start working with administration and planting that seed. We're starting to work with legislators and planting that seed. But if you look at the report that Blue and Company did when Matt, Beth, and some of us attended the secretary meeting, the gap in sustainability was around 90 million. The surcharge would create exactly 90 million a year. And so that is a solution we are starting to shape again, not for this session because it's short session, but we will be planting the seeds for budget session. So that is how we are looking to address that. Matt, does that answer your questions there?
I hope so. Yes. You know, I mean, thank you. I know we're doing everything we can. And things are headed in the right direction from the organization's standpoint, from where I am in terms of what we have to do. We're ready to do it, and we're doing it now. It's looking at the long-term funding of that, that I just want to get that squared away.
Absolutely.
As much as we can with clear answers. Because, you know, we have to make the argument that the investment in mental health is worth it, right? So we do have to spend $1 in mental health, but how many are you going to save elsewhere? That's what we're here for. I mean, from the standpoint of finances, what we're really here for is to make people's lives better and society better and create productive individuals. And, you know, it is a win-win just to get that message over and over to people in the legislature and to the secretary that what we do brings value to society at every level.
Yeah, and one chess piece that I did not share in that strategic direction, there is also a very large federal CCBHC bill that, because of the shutdown, did not drop yet. It is going to be dropping. It has bipartisan support. And so as soon as that bill drops, there will be a lot of advocacy from us. We will be scheduling webinars with federal legislators. We will be getting people plugged in on that advocacy, because that federal direction and seeing that federal direction move further will help the secretary to have trust to move it forward in the state. And so we really need that piece to move forward. And so I've know of the outline of that policy. And as soon as that starts getting traction, I will be sure to engage everyone so that we can put our voice to that on a federal level. Because remember, it starts with you locally, goes to state, and then federally. And all three of those need to be connected in this transformation. So we will be sure to share that as soon as we learn that it's going to be moving forward.
And that's different than the Rural Health Transformation Fund?
Yes, very different, Steve.
Okay.
Yeah. The Rural Health Transformation Fund is the federal dollars that were given as part of the budget bill. And we have been involved in that work group discussion. The proposals have been sent to CMS. All 50 states have applied. And so we are waiting to hear back from CMS on the approval. And that's the first tier of that funding. And then there's going to be a second tier that's going to create regional hubs. And so as that information gets shared by the state, that is going to be an excellent opportunity for all of you to be at the table in these regional discussions on how they can use those rural health dollars. The first bout of money was more for kind of systematic statewide change. The second is going to be more local, and we will be keeping you all posted on that. Great question. Any other questions, thoughts from the group? Sid, any final words before I wrap us up?
Stay tuned.
Okay, well, yes. So as you have heard, it will be fast, it will be furious, but we will be communicating with all of you every step of the way. Please do not hesitate to reach out. As Steve mentioned, if you do not have February 17th on your calendar and have not registered, please do so. That will be our time to really start planting the seeds for budget session. So even though we don't have policy for this session, we are looking ahead to ensure that we have full system transformation. And then I did want to also share that we are in a season of gratitude. So I wanted to thank all of you. Hope you all have a wonderful Thanksgiving holiday with family and friends. Yesterday was my 4-year anniversary with the Indiana Council, and I am forever grateful to all of you on this call for making it a phenomenal 4 years. So let's continue to move us forward. Raise your cups. And Mary at Aspire is our Starbucks winner. So Mary, we will be getting you that gift card. And so cheers to everyone. And I hope you have a great day. If there's anything you need, you know where to find us. Thank you, team, for being on. Appreciate all of you.